كل أسبوع معاكم وموضوع طبي مختلف. عنوان حلقتنا اليوم خدمات التجميل في المستشفى الدولي. اليوم معانا ضيف مميز ومتميز في مجاله، لقب بجراح المشاهير. معانا البروفيسور الدكتور ريزا نابافيان. Dr. Riza, it's our pleasure to have you with us tonight in this live program, and congratulations for joining us at the International Hospital as the head of plastic surgery department in International Hospital. Dr. Riza, please allow me to briefly introduce you to the audience in Arabic, and I'll get back to you, and I'm sure we'll have a very exciting talk tonight. دكتور ريزا نابافيان استشاري وبروفيسور في جراحة التجميل في لوس أنجلوس كاليفورنيا، وهو حاصل على البورد الأمريكي في جراحة التجميل، وهو مدير قسم جراحة التجميل في جامعة ساوث كاليفورنيا كيك سكول اوف ميديسن. لديه رخصة لممارسة جراحات التجميل في سانتا مونيكا كاليفورنيا، جنيف وسويسرا. قبل لا نبدأ دردشتنا مع دكتورنا، أحب أذكركم أن احنا نستقبل أسئلتكم سواء بالاتصال أو رسالة على الواتساب. تتصلون على البرنامج وفي هدية للمتصلين، استشارة مجانية مع دكتور ريزا. أنا راح أسأل الدكتور بالإنجليزي وترجم لكم بالعربي. So, Dr. Riza, without further delay, let's start our chat tonight. Now, since there has been a huge rise in doing aesthetic procedures over the past 2 decades, undergoing a plastic surgery, I think, is a unique decision, sometimes is a brave decision. And I think what makes one feel beautiful may vary from person to person. So, Dr. Riza, what is your definition of beauty?
Good evening, and thank you for having me here. It's a pleasure. And I'm very excited about the International Hospital and the state-of-the-art center that we are providing for our clients. I think you touch on a very interesting question, the concept of beauty and how it fits into the practice of plastic surgery. As you know, plastic surgery is really a medical surgical science, and in cosmetic surgery we are combining the medicine and beauty in a way that doesn't exist in the rest of surgical and medical field. So beauty, obviously very subjective. It depends on the race, ethnic background, and also the state of mind. Many times the energy and the feeling that someone projects, it really comes from within, and not necessarily from all the physical attributes. But still, there are certain ratios and certain concepts in aesthetics that we try to apply, whether it's in the cosmetic surgery of the face or the nose, the breast or the body. But these concepts are not unique, and they are varying from culture to culture.
Yes. So there are no certain like guidelines that we may follow to say that this lady is pretty or this lady is not pretty, right?
Well, they're not necessarily guidelines, but there are some ratios. You know, there is, for instance, certain ratios in the face where if you measure certain width to the length, there is certain mathematical numbers that are found in beautiful people.
Yeah.
But that's really not, I don't think, is the purpose of plastic surgery. The purpose of plastic surgery is to identify a person's nice features and make those better and try to improve it in a way that they feel better about themselves.
Okay. Do you think, Professor Riza, do you think that the social media has influence on public interest in cosmetic surgery, or is it peer pressure, or is it multifactorial? I mean, even our perspectives or images of beauty had changed. Like, for example, over the past, let's say, decade, a woman with a full round face was the example of beauty.
Right.
Now it's totally different. The
Exactly.
triangular shape with jaw definition, nasal tip, maybe cheek contour. It's different. So do you think social media had influence on this?
Social media, you're
No.
correct. Social media has a tremendous effect, both positively and negatively. I think positive in a sense that people can follow beautiful things and beautiful operations and improve their lives. Negatively, because I think in social media we portray an image of perfection, and that puts a lot of pressure on folks that they think this is the ideal for everyone. So I think from the standpoint of the psychology and the effect on people, I think we have to be cautious about the negative effects of social media.
Yes, yes. And Dr. Reza, what types of surgeries do you do at the International Hospital? And I know that you have been working at other local hospitals in Kuwait as a visiting plastic surgeon. But now that you have joined International Hospital, do you have, and International Hospital, as we all know, is the biggest private hospital in Kuwait. Do you have any near future plans to expand your cosmetic team, or what is your vision with this regard?
Yes, yes, I have been coming to Kuwait visiting for about 11 years at a different hospital, and the last few months we have begun making our center at International. I'm bringing several plastic surgeons from Europe to complete the services we offer, including all-female plastic surgery, all-female team, as well as the additional treatments for skin care and skin health and wellness, which we will present in stage fashion.
So do you have a full female plastic surgery team, or
yes, that's
you
what
are in the process of completing this team?
The whole
That's
team.
very good. Excellent.
I think
Excellent.
that can be helpful.
Okay, and let's talk about the most common, or what types of surgeries do you do at International Hospital?
Yes. I mean, I practice the complete range of plastic surgery. Many of my patients come for rhinoplasty or nose surgery. Many are patients who need tummy tuck and breast surgery, which is called mommy makeover, after giving birth, and patients who have lost a lot of weight and they have a lot of skin in the body. And also I have patients for facial rejuvenation and facelifts as well. So it's really the complete range of cosmetic procedures we have.
Right, okay. And you have all these facilities at the theater and International Hospital?
The facilities at International Hospital are top-notch in terms of the quality of the operating room, the equipment, the nursing, and the flow of the hospital, the hospitality is top-notch. So I have very good confidence since I've moved here to be able to be as busy as I am.
Yeah. So now we will break for a while. ناخذ فاصل. نذكركم بأرقام أو رقم البرنامج للاتصال، أو ممكن تبعثون واتساب مسج ترسلون سؤالكم. 222-16-888. ممكن تتصلون أو تبعثون رسالة على الواتساب. ونذكركم برقم المستشفى الدولي 181-371. موقع المستشفى السالمية شارع قطر. هاي من الأسئلة اللي وايد تجيني، وين مكان المستشفى بالضبط. ففي انتظار اتصالكم، واللي يتصل بنعطيه هدية استشارة مجانية مع دكتور ريزا. Okay, back to Dr. Reza now. I would like to ask you about body contouring surgeries. They are very popular nowadays. Can you elaborate more on this procedure, and what are the advances in body contouring surgeries? Can this procedure be done under local anesthesia?
Sure. Body contouring, I would categorize it as using liposuction for contouring the body. And this is an operation that over the last 20 years has really advanced in terms of the technique as well as the equipment that we have. So it was a time where liposuction was only removing fat from some areas. But now it's a three-dimensional shaping of the body where we remove it from the areas that we don't want and also add it to some areas that patients might want to add. And this technique has improved because the liposuction technology has improved. We now use laser or ultrasonic assisted liposuction, which will help remove more fat in a better way, and also helps with the tightening of the skin that is left behind after liposuction. There are some additional tools such as plasma, J-plasma, and other modalities that may also help in the results and outcome from body contouring.
So plasma or J plasma,
Yes.
that would help with the skin tightening post fat removal.
Yes,
Yeah.
in someone who has already good skin, when we remove the fat and use these modalities, they get really good results. But in some patients, after removal of the fat, they need surgical excision to really tighten the skin. But for some patients, the technology can be helpful.
I see. And Dr. Reza, how about body definition? Like, six packs.
Yes,
And
yes.
will that be achieved with laser or J plasma?
Yes, I mean, there are, I personally don't perform the six-pack operation. I think it may be a little bit too much in terms of what body contouring should be. But when I do body contouring, we look at shadows and highlights. There are areas of a beautiful abdomen where the sides drop in and there is some, clefts in the middle. So those things, with the new technology, we can really help create this nice contour and nice shadows. If you go further, there are some procedures where you have to actually damage the skin to create six-pack, for instance, in a man who's bodybuilding. And I find these operations sort of extreme. I think it's maybe going a little bit too far in what we really intend to do.
Right, okay. But then prior to surgeries, you usually, أنا آسفة ما قاعدة أترجم. Sorry. سألت الدكتور عن جراحات نحت الجسم، وسألته إذا كان في الإمكان أنه يقوم في هذه الجراحات مع البنج الموضعي مو البنج العام. فطبعا قال يعتمد على كمية الدهون اللي راح يتم إزالتها من المريض أو المريضة. وقال طبعا أنه ممكن يقوم في نقل الدهون من منطقة إلى أخرى. وقال أنه حاليا ما بس نسوي العمليات هذه بالكلاسيكال أو الطرق القديمة الكلاسيكية، في عندنا أجهزة تساعد على الريكفري وفترة يعني النقاهة، يعني يصير أسرع بعد العملية وتعطي صورة أحسن أيضا للجسم. وخاصة أنه طبعا مع إزالة كميات كبيرة من الدهون من الجسم ممكن ينتج هذا، يعني ممكن يسبب ترهل في الجلد. فيقول أنه في أجهزة جديدة حاليا ممكن تساعد في مثل هذا الموضوع. But you should always explain, of course, to your patient that the result of liposuction or body contouring is not immediately. They have to wait for probably 3 to 6 months to get the final results. Or what do you think?
Yes, the results take about 2 to 6 months to mature, and they need to also maintain a healthy lifestyle and fitness, because many things, for instance, the muscle and the fat composition of the body can change after liposuction. So when I see a patient for body contouring, I want to make sure that this is a lifestyle change for them as well. So we are not using liposuction as a weight loss operation, but as shaping and beauty of the patient.
Right, okay. And so what do you think patients need to know before they go under your knife, Dr. Reza? Do you usually make sure that you and your patient are on the same page?
Yeah, that's
actually this is very important.
Yeah, this is probably the most important part of my work, because when I see a patient who comes in for consultation for any procedure, my first thought is, should I do this operation for this patient? Does she really need it? And does she have realistic expectation? Or maybe I try to find reasons first not to do the operation. And once I learn about the patient and what she wants, then we engage in understanding what is she expecting. What is in her mind? Is this decision that she's making on her own? Is she under pressure from somebody in her immediate family or media or those things? So
which can happen. You have faced
it happens all the time, and
facing certain
and I'm proud to say maybe every 10 patients there are at least 2 patients that I say no to, And they agree that that's not a good operation for them, which means that the other 8 patients are qualified to have the operation. So it's really, we have to come from the perspective of what is inside the head of the patient, psychologically, in seeking the operation.
سألت الدكتور إذا كان قبل العملية مع الاستشارة هل مهم عنده يعرف توقعات المريض من نتيجة العملية، ولازم تكون توقعات المريض واقعية. يعني في بعض المرضى عندهم توقعات خيالية above expectation من الدكتور، يعتقد هذا ممكن يحصل مع العملية الواحدة مثلا for example. فالدكتور يقول أنا في حالات فعلا رديتها المريض ما كان عارف بالضبط أصلا هو ايش يبي من هالجراحة، وما كان عارف هو شنو ممكن يعني النتيجة النهائية من الجراحة. فسألت إذا في فعلا حالات أنت رديتها، قال أي في حالات أنا رديتها. ودائما طبعا يعني لازم المريض يعرف أن النتيجة النهائية ما تكون مباشرة بعد العملية، تاخذ وقت، تاخذ من 3 إلى 6 أشهر. ويقول إنه دائما ينصح الناس اللي يسوون عمليات اللايبوسكشن أو عمليات نحت الجسم أو عمليات الشفط، يعني نسميها عمليات شفط الدهون، أنهم يحافظون على نظام حياة صحي، ممارسة الرياضة، شرب الماء بكثرة، والأكل الصحي، عشان حتى يحافظون على النتيجة اللي حصلوا عليها. يعني خاصة نعرف أن عمليات شفط الدهون ممكن يتم إزالة الفات أو الدهن في المنطقة نفسها، بس ممكن تطلع في مناطق أخرى، ممكن بعدين يصير الجسم ما في تناسق. فضروري جدا المعلومات هذه يعرفها المريض قبل العملية، وبعد العملية يكون يغير أسلوب حياته وطريقته. Okay. What do you think is the hardest plastic surgery?
It's tough to say. I think in liposuction, I think it's probably the most challenging because it's a very 3-dimensional, large areas. So I think to know how much fat to remove from which part of the body requires a lot of experience. But I mean, in my mind, really every operation is critical, and every operation needs full focus and full attention. Because patients pay a lot of attention to that body part. That's why they came for surgery. So we have to pay a lot of attention to details. The nice thing about the operations is once we can educate the patient and she understands and we get the result, it really helps their self-confidence. You know, we see it in the way they come back for their follow-ups after 1 month, 2 months. Even the way they walk, the way they dress, and everything has changed. So I find that part of it very rewarding.
Yes. So how about rhinoplasty? Do you not think that it is a complex procedure?
Rhinoplasty is a very complex procedure. It requires really a lot of expertise. And we improve our technique and also understanding of what the patients are looking for. You know, more and more my patients in rhinoplasty are asking for natural results. They have seen problems in the social media, and so they have a good idea what they want to do, and more they want something that is a normal nose but better, not so much a completely different nose.
I think that should be their goal. Their probably nose with more definition or a bit
better.
Smaller.
Yes.
Yeah, they should be realistic.
And you know, and sometimes they show me pictures of maybe some actress or singer, and I tell them, you know, each person is unique. You know, we never say I want to make your nose like such and such actress, because there are so many different features between that actress and the patient, and so the nose has to match the patient. It's not like getting a haircut, for instance. You know, it's a little bit more complicated, like you said.
Yeah. So you don't go by her wish, for example, if she wants her nose job to be, or her nose to copy or to mimic a celebrity or
as long as her wish is reasonable, you know. So if somebody has very large nose, very thick skin, and she comes to me and says I want, and shows me a picture of this little nose, I will tell her that it's not possible, and she will have issues and problems with breathing, and her nose won't look natural. And I'm flexible. For instance, in some people, they want a little bit smaller, or they want to have a slight curve. So I understand that and try to match their expectations. But if I find that what they're looking for is outside the norm and it's not reasonable, that I wouldn't do on my sister, daughter, mother, then I won't perform it on the patient.
اوكي. سألت الدكتور عن أصعب العمليات الجراحية يعني من وجهة نظره، فقال إن عمليات نحت الجسم أحيانا تكون صعبة، مو من ناحية التكنيكاليتي نفسها، بس المريض وتوقعاته بعد العملية. فكان يقول إن النصايح اللي قبل العملية وبعد العملية with regards to أسلوب حياتهم بعد العملية وايد مهمة. وبعدين تكلمنا عن عمليات الأنف، تجميل الأنف، وحتى إن هذه تعتبر من العمليات اللي مو وايد سهلة، معقدة شوي، لأن حتى النتيجة النهائية ترى تختلف من شخص إلى آخر. أنسجة الخشم بعد تختلف من شخص إلى آخر، ومدى سماكة الجلد تختلف من شخص إلى آخر. ويقول أنا مو دايما أطاوع مرضاي، مثلا تيني واحدة تبي تقلد خشم ممثلة أو خشم أحد مشهور، يقول مو دايما أطاوع مرضاي، بس أحاول أن أتفق وياها نوصل إلى نتيجة ترضي الطرفين. الحين راح نطلع فاصل، نذكر برقم البرنامج 32216388، تقدرون تتصلون أو تبعثون رسالة على الواتساب. نرجع ونحب نذكر برقم الهاتف 32216388 للاتصال. نسأل جراح المشاهير دكتور ريزا نابافيان، تقدرون تتصلون أو تبعثون رسالة على الواتساب. اوكي. احنا كنا نتناقش بالفاصل عن عمليات تجميل الانف، فكان يقول الدكتور ان دائما عمليه تجميل الانف تعطي النتائج الاحسن والاكثر طبيعيه لما تجرى لاول مره. فكان يقول انه مهم جدا النقاش يكون واضح بين الطبيب والمريض قبل اجراء العمليه، علشان نتاكد ان احنا يعني الدكتور والمريض فاهمين الجولز او يعني الاهداف من العمليه والنتائج، ولا تكون توقعات المريض يعني غير واقعيه. Okay, Dr. Riza, let's talk a bit about male cosmetic surgeries. Now, male cosmetic surgeries are on the rise as well. Now, men are competing with us for
yes.
plastic surgeries and for dermatological procedures, Botox and fillers. So, what is the percentage of male to females clients do you have in your clinic?
Good question. You know, when I started practice about 20 years ago, I would say for every 20 female patients, I would have one male patient. But now I think about 20%. So 2 out of every 10 are men. And there are some differences in terms of the procedures they request. But you're right, they're competing with women. And most of the operations for men involve the nose, rhinoplasty, the surgeries after weight loss. So the men who've had the sleeve or bypass operation. Those are the two main
surgeries for men. And why do you think that the percentage of men seeking beauty is rising?
I think maybe they are also affected by social media and the interactions between male and female obviously determines what everyone is looking for. And since the surgery has become more widespread and they have more comfort in terms of the safety of it, they're feeling courageous to take on aesthetic surgery.
أنا سألت الدكتور عن جراحات التجميل اللي يجريها الرجال. يعني احنا كنا في السابق، خلينا نقول يعني الباست 10 سنوات السابقة، كنا بنسب قليلة أو من النادر حتى أن نشوف الرجال يقومون بعمليات تجميل. بس الحين الأعداد هذه وايد زادت، وصاروا الريايل يسابقون الحريم في إجراء عمليات التجميل. فيقول لي إن من يمكن 10 سنين أو 15 سنة تقريبا نسبة الرجال إلى النساء 1% في العيادة اللي راجعونه. يقول بس الحين النسبة هذه زادت إلى تقريبا 20%، يعني من بين كل 100 مريض أو مراجعية عنده 80 يكونون من النساء و20 من الرجال. ويقول أكثر العمليات التجميلية اللي يجريها الرجال عملية تجميل الأنف، وجراحات البطن والجسم بعد عمليات التنحيف. Now, another important question, Dr. Riza, is cosmetic surgeries after massive weight loss and after bariatric surgeries, since this is also, again, very, very common, sleeve and bypass surgeries.
Yes, absolutely. And over the past, I think, 10 years in Kuwait, there have been many bypass and tacmim operations. So now, as these patients have lost weight, we have to fix all the areas of the body that have now too much skin. The abdomen, the back, the thighs, the arms, the breast, and in some cases also the face. And I think that's an important consideration as patients go for weight loss operations, to understand that these are some of the operations that they might need once they reach their ideal goal.
Yeah, and that's both for men and women.
Both for
but
men
then
and women.
do you go, the 360 incision? Is that a certain situation who need this type of...
certain situations where there has been a significant weight loss, the entire body has to be modified with less skin. One point I think that I have noticed is that, while there is a target weight for the patients to feel good and be healthy, it shouldn't necessarily be a particular number. For instance, let's say somebody weighs 100 and they like to be at 60, but their body and their composition might be better when they're 75.
Yeah.
So I think that's all. Sometimes there is too much weight loss, which then results in too much skin as well.
Okay. So do you have some guidelines to be able or to agree to perform such surgeries?
The main guideline is that they're healthy and they can withstand the operation, and also they have realistic expectations in terms of how their body will look.
Yeah. Okay. And can we talk a bit about facelift?
Yes.
Ponytail facelift as well?
Yes. So facelift,
Sorry? Okay.
Facelift really involves three parts of the face. We say facelift, but the forehead and the eyebrows and the eyes, the mid-face, and then the lower part and the neck. And depending on the age of the patient and how the condition is, I will devise, what is needed. The new techniques in facelift with the placement of the scar is behind the ear or inside the ear. So I can see now more patients in their 40s and 50s decide to have facelift because the scars are acceptable and the surgeries are not as complicated than when they're much older and need a more aggressive operation. The ponytail is a large term, but it involves lifting up the forehead in some areas that helps the shape and the angles of the eyebrows.
So the ponytail is just for that upper part? It doesn't involve the contours.
The
jawline and
the
neck.
jawline and the neck are part of the traditional facelift. And when some people use the term ponytail, it means that the upper part of the face is also affected with the lift.
Okay. Is that involving what they call cat eyes, or?
Yeah. For instance, you can lift the outer edge of the eyebrow inside the hairline.
Yeah.
And from my personal view is that some folks are really overdoing this operation. When you see patients where the eyebrows are lifted way up and it's no longer aesthetic. So, and that's why I don't really use the term ponytail lift, and I don't want to get the patients into feeling that there's a standard operation that they need to look good. It goes back into seeing how does the patient look, how's their beauty, what is their expectation, and each person is different.
Correct. أنا قاعدة أنسى أترجم فذكروني. أول شيء سألته سؤال عن العمليات اللي يتم إجراءها بعد عمليات مثلا السليب والباي باس، اللي هو بعد عمليات تنزيل الوزن. طبعا اللي ينتج عنها ترهل شديد في الجلد. فيقول انه يقوم بمثل هذه العمليات ويعتمد على حسب درجة الترهل. طبعا في اختلافات فردية بين شخص والثاني بالنسبة لدرجة الترهل وبالنسبة حتى لنوعية الجلد. وسألته إذا يسوي أكيد طبعا هو يسوي السكار اللي هو يسمونه 360 degrees. قال again يعتمد على درجة الترهل اللي المريض عنده إياها. وفي طبعا إجراءات بعد العملية لتحسين من مظهر السكار. السؤال اللي بعده سألته عن عمليات شد الوجه. سألته عن ما يسمى ببوني تيل فيس ليفت، فهي عمليات الشد للجزء العلوي من الوجه، الفورهيد، اليبهة والحواجب وهالجزء يعني مع التشيك بونز. هذا يعني أنا قاعدة أترجم كذي مع التشيك بونز. فقال انه هو يقوم في اجرائها. يقول بس يعني وايد اكون حريص مع المريض على النتيجه النهائيه، ان يعني واقول لهم ان ترى في اختلافات فرديه، مو اللي يلوق على شخص مو شرط انه يلوق على الشخص الثاني. يقول اهم شيء ان العمليه تكون نتيجتها طبيعيه. وفعلا هو جراح التجميل الشاطر اللي يسوي اجراء تجميلي ويبين وايد طبيعي على الشخص. يعني حتى مثلا ما يلاحظون صديقاتها، ما يلاحظون اللي حواليها ان هي مسويه شيء حق وجهها، بس ان شي لوكس يعني مور فريش وشكلها صار كأنها مرتاحه اكثر. في سؤال عن عمليات تجميل الجفن. فاصل اوكي. I'll ask you after the break about blepharoplasty. مرة ثانية نذكر برقم هاتف البرنامج 321638. تقدرون تتصلون أو تبعثون رسالة على الواتساب. عندنا سؤال واللي جاوبه راح يحصل جائزة من المستشفى الدولي. الجائزة عبارة عن استشارة مجانية مع دكتور ريزا. أين يقع المستشفى الدولي؟ أوكي خلاص عشان لا تسألون عن تجميل وكل واحدة يعني يمكن في إحراج إذا تسألون عن عمليات تجميل. يلا بس جاوبونا على هالسؤال، وين مكان المستشفى الدولي، وراح تحصلون على الجائزة إن شاء الله. وحاليا بمناسبة العيد الوطني عندنا خصومات أو عروض فبراير 20% على إجراءات البوتوكس والليزر في المستشفى الدولي. رقم المستشفى الدولي 18371. هذا رقم الكول سنتر 1811371. رقم المستشفى الدولي 1811371. طبعا رقم الكول سنتر تقدرون تدقون وتاخذون مواعيدكم. سؤال المسابقة أين يقع المستشفى الدولي؟ اوكي. ونذكركم بالعروض. وحتى انا في عياده الروماتيزم مسويه عروض على البلازما بس خلال شهر فبراير، بلازما المفاصل بس خلال شهر فبراير. Okay, Dr. Riza, let's talk about blepharoplasty. And I have a question from a lady who says that she had a filler under her eyes, and now this area under the eyes has become lumpy and it looks ugly, and the puffiness became more than what she started with. Actually, her eyes were hollow and now like puffy but over. So what do you advise?
If the filler is a temporary filler, it can be dissolved by certain injections. Mm-hmm. But if it's a permanent filler or something that doesn't go away with that, she may need to see an eye specialist, and there should be surgery to remove the fillers directly. It's complicated, unfortunately.
So if it's temporary, you can dissolve it with hyaluronase.
Hyaluronase, yeah. But usually the surgeon who injected or the doctor who injected is the best one to dissolve for.
I see. اوكي. انا سألت الدكتور، في مريضة متصلة تقول إنها حطت فيلر في تحت منطقة تحت العين، والحين المنطقة هذه صار فيها تكتل الفيلر. كانت مشكلتها الأساسية إن المنطقة اللي تحت العين شوية مثل ما يقولون غايرة أو هالو، الحين صارت بالعكس متكتلة ومنتفخة بشكل غير محبب. فيقول إذا كان الفيلر دائم أنا أنصح إن تروح طبيب جراحة العيون، عندهم طريقة لإزالة الفيلر الدائم. مع ان الايام هذه يعني ما صار يسوون فيلر دائم، اصلا ممنوع انه يسوون فيلر دائم. ما ادري بعد اذا بعض العيادات للحين تسوي هالبروسيجر. يقول اما اذا كان الفيلر مؤقت ممكن انه يشيله عن طريق ماده تذوب الفيلر اسمها هايلورينيز. فهذا كان جواب الدكتور. في سؤال عن عمليات شد الجفن. لا, let's talk about blepharoplasty as well. And I think this is one of the popular cosmetic procedures for both men and women.
Yes, interesting. You know, there's three areas for the eyes. One is the most common one we talk about is the upper eyelid where the skin gets heavy, and also the edge of the eyebrow drops. So usually I combine the upper eyelids with a small brow lift to improve the upper part. There is sometimes extra skin and fat in the lower eyelid that can be also removed. But everything in the eye has to be done very carefully and cautiously, because if someone has too much skin removed, it's going to be a problem for their eyes.
So do you sometimes do only the upper and you don't do the lower if you think the patient doesn't need the lower?
Exactly. Many times I do that. But the most helpful procedure I found for the upper eyelid is when I also lift the edge of the brow. Because many times this area when it comes down, it makes the upper eyelid look full. But when the brow goes into the right place, then the upper eyelid.
I think it's such a sensitive procedure, and you need an experienced, of course, cosmetic surgeon to do this, because I've seen like inverted lower eyelid with excessive blepharoplasty or lid retraction and removal of fat.
Absolutely, you're absolutely right.
فسألت الدكتور عن العمليات التجميلية لمنطقة الجفن. فيقول في بعض الحالات المريض يكون يحتاج بس عملية مثلا إزالة الجلد الزائد من الجفن العلوي، وبعض الحالات الانتفاخات والجلد المترهل في الجفن السفلي. يقول في حالات أخرى أسوي الاثنين. يقول في يعني العملية هذه دقيقة علشان النتيجة النهائية تكون طبيعية، لأن في حالات نشوف بعد العملية المريض يصير عنده الستيري لوك اللي كنا مبحلق أو إن الجفن السفلي يكون كنا شوي مقلوب إذا صار أن الشد زايد عن اللازم أثناء العملية، أو إذا تمت إزالة كمية كبيرة من الفات أو من الدهون تحت الجفن. Okay, breast surgeries, again very popular cosmetic surgeries. Let's talk about it. And what do you perform at International Hospital?
I perform, three types of breast surgery. One is breast augmentation, and normally I use silicone implants for augmentation. But for certain patients, I'm also using fat injections. So can improve the volume of the breast using patient's own fat, which can be helpful. I'm also performing breast lifting as well as reduction. As you know, many women with large breasts suffer from neck pain, shoulder pain. So breast reduction is helpful to alleviate those pain and symptoms.
Yeah. So this is cosmetic and non-cosmetic goals from breast reduction surgeries.
But I think the newest thing in breast surgery is number one, the quality of the silicone implants have improved. And number two, for some patients who don't want to have silicone, we have the option of fat for small augmentation.
Okay. And of course, we would like just to reassure the audience that the subject itself is non-carcinogenic.
Right.
Yeah.
Yes.
But do you do sometimes for those who don't wish for like silicone implant? Do you do fat transfer to breast as well?
Yes. For some patients, fat can be a good choice for small changes in the volume or also shaping the breast. Yes.
Okay. And سألت الدكتور عن عمليات الثدي الشائعة. فيقول إنه هو يسوي 3 أنواع من عمليات الثدي. عمليات تكبير الثدي يستخدم فيها مادة سيليكون. You don't want to mention the brand of the silicone you use, right?
I usually use the Mentor implants, which is the best American.
Right, okay. يقول إنه يستخدم مادة منتور. هذا نوع السيليكون اللي يستخدمه السيليكون الأمريكي. وطبعا يقول أحب أطمنهم أن السيليكون هذا آمن. يقول في حالات أخرى تكون السيدات لها رغبة في تكبير الثدي عن طريق شفط الدهون من منطقة في الجسم وحقنة في منطقة الثدي. يقول من العمليات الأخرى الشائعة للثدي أيضا عمليات تصغير الثدي اللي هي أصلا تكون أصعب من عملية تكبير الثدي. يقولوا هذا إجراء يجرى لأسباب تجميلية وغير تجميلية. طبعا في وايد حريم مع كبر حجم الثدي ممكن يأثر على منطقة الرقبة وفقرات الرقبة وتصير عندهم يعني أعراض وآلام في هذه المنطقة، فتكون هني يعني هو إجراء تجميلي وكذلك ميديكال يعني. السؤال did you say 3 times right? Augmentation
And the lifting is when you don't make the breast smaller, but you remove the extra skin to create the shape.
Yes. وعمليات شد الثدي يقول بعد الولادات المتكررة أو بعد فقدان وزن كبير بالسليف أو شو اسمه سليف bypass surgery. Okay. So عندنا الفائزة بالجائزة اسمها أميرة، هي اللي فازت، دزت لنا الجواب على الواتساب. ما أدري إيش فيهم اليوم المستمعين منحرجين يدقون، ما أدري ليش. المهم أميرة فازت، ولك يا أميرة استشارة مجانية مع دكتور ريزا. مرة ثانية أحب أذكر في عروض فبراير 20% على إجراءات التجميل البوتوكس، مو عمليات تجميل، إجراءات تجميل بوتوكس وفيلرز، وفي إجراءات تانية في قسم الجهاز الهضمي، وحتى أنا بعيادتي عيادة الروماتيزم، بس مو على كل شيء بعيادتي، بس البلازما بلازما المفاصل. Okay, and finally, Dr. Reza, it was a pleasure. Are we concluding? Yeah. So before we conclude, can you give us your advice and how do you make sure that you and your patient both reaching realistic goals about the outcome of surgery and advice in general?
It's been a pleasure also being with you and the audience. You know, I think the most important thing is don't overdo it. You know, plastic surgery is here. We can perform it safely for you, but we need to find good reasons so that it's really an improvement in your life. We don't want to take you to surgery unnecessarily. And make sure that we communicate really well about what I think and what they want and whether it's a good match. And inshallah, if it's a good match, everything will turn out fine.
inshallah. And أنا بعطيكم نصايح للحفاظ على جمالكم. سوري أنا ما ترجمت، قولوا لي ترجم. يقول الدكتور لما سألته شنو نصايحك بشكل عام، كان يقول أنا ما أنصح أن الواحد يصير أوبر في إجراء عمليات التجميل. في النهاية الواحد يبي يحافظ على شكل طبيعي. وأنا أقول لكم أنه وايد مهم أنه يكون عندكم الرضا الداخلي اللي فعلا ينعكس على الوجه. طبعا مو غلط أن الوحدة تهتم، الوحدة أو الواحد، الحين صار الجمال مطلب للرجال والنساء. الاهتمام بالنفس أكيد مو غلط، المحافظة على الأكل الصحي، شرب الماء، سن بلوك، ممارسة الرياضة بصفة مستمرة، أكيد هذا مهم. بعدين يعني حبي نفسك عشان الناس يحبونك، لا تنسين نفسك لها حق عليك، دللي نفسك، لا تنطرين أحد يدللك. طبعا إذا في أحد يدللك بعد يعني هم أحسن وأحسن، زيادة الخير خيرين. سوي الأشياء اللي تجلب لك السعادة، لا تربطين سعادتك بوجود شخص أو موقف أو أشخاص في حياتك. وفي النهاية نتمنى لكم الصحة والعافية والسعادة، ولنا لقاء آخر إن شاء الله.
إن شاء الله.
Thank you.